Hello and welcome to Level 3 Health and Social Care. You're in Unit 6 looking at stroke or CVA, and we're in our fourth week of the unit now, and we're looking at the first part of it. And we're going to focus on the roles and interventions of the stroke rehabilitation team. So the objective and the assignment that we're going to be looking at today is 3.2, discuss the roles and interventions of the rehabilitation team, and really focus on the fact that it's asking you to talk about sort of the interventions, the things that they do, but the roles, like who are they, who are these people, and what do they do when you're answering the question. So, stroke rehab, what's it all about? The aim of it is to try and help people relearn the skills that they lost when the stroke affected them, and it's to enable them to regain as much independence as possible, and of course improve their quality of life. Now, we've already talked about the fact that stroke affects all sorts of people differently, and the severity is really varies from one person to another. So you can't always predict. People who get very experienced in rehab can actually look at the different levels of ability and probably have some idea of those who are probably going to improve quicker than others just because of how they're presenting. But really, you can never say for sure. And a lot of it also depends on the motivation of the individual. Some people are so motivated that they will overcome very difficult odds and achieve things, whereas other people lose all motivation. And that's one of the big issues for stroke patients is that they can lose their motivation. And and that's a real shame because some people may not rehabilitate as well as they could when in fact they do have the ability to do it, but they don't have the motivation to do it. So that's a piece of work you as a support worker can really do, help working with people on their motivation. There's very clear research to show that people who actually participate in a very clear and focused rehab program will normally fare better than those who don't. So, what's involved in a rehab program? Well, there's lots of different approaches that can be taken, and you can do some wider reading about that yourself. And the plan will really, as I said, it's very individual, it's very focused on the symptoms, the problems that you're presenting with. So one person's plan can be totally different from another's. One person's plan might have a lot more work on the physical because maybe they've got a lot more paralysis or a lot more dead heavyweight legs, arms, that sort of thing. Some people may be really focusing on their speech, some people on the cognitive ability. So it's really different. Some people very often will be a mixture of all of these things, so they will need an element in their plan to look at each of them. You can look up lots of different stroke plans. Here's just an idea of one. It's usually set together into a timetable with timings on it, really, so that people know what's going on. There's this one here has some aerobic activity, and that's about building people's strength and stamina. Because if they don't have the strength and the stamina to work on their program, that reduces their motivation as well. There'll be strengths activity. So here, so if you're looking at this one's focused around the goals of opening a water bottle. So putting all those different skills together and working on the muscles that need to maybe they've got a side that's been affected and they're trying to be able to open bottles again. So they'll break it down into individual goals and there'll be a plan for each goal. And obviously they won't contradict each other. So where they're doing a strength session, the strength session will cover all the needs really. But they might just start with short-term goals, focusing on small things like opening a bottle of water, and then after a few weeks, they'll move on to another goal. So it's really, as I said, very, very specific. But here's some idea. There's a bit of training in the home. So so if it's all about people, this person maybe has lost their strength, lost their grip, They might do a little bit of work like lifting saucepans, assessing how well they can do that, maybe finding something that can help them lift a saucepan, or maybe just lifting a smaller pan, those sorts of things. So they'll be doing a little bit of home training with them on that. They'll do some very specific training on the go, which is opening and closing a water bottle, really. And there'll be some general physical strength training for grip work, arm work, that sort of thing. So it'll be broken up. So if you Google stroke rehab plans, you'll be able to find lots of different plans, so you can get a really good flavour of the sort of things that are created. But as you can see, it's broken down into quite small areas. You can see in here, they, as well as the home training, aerobic activity is general for general fitness and stamina, but also they have meditation times. And this again is to help with the motivation. It's to give people a chance to calm, de-stress, decompress, because sometimes this work can be very, very frustrating if your hand's not following your commands, like you're trying to do something, and they will be frustrated for a while. And that meditation time, um, a few sessions of it sort of filtered through your weekly plan, really helps people to decompress. So quite a good idea, really. So let's have a look at the sort of interventions. We're gonna focus first on the general types of interventions that can be done, and then afterwards we're going to talk about who the individuals are who might be doing some of these things. So motor skills, lots and lots of exercises, often carried out by physiotherapists. Some of the simpler ones can be trained on by physiotherapists to someone's regular care support. So maybe family at home, or maybe if they're going to a care home, maybe as the care support workers can learn some of these things. They do a lot of motor skills exercises to improve muscle and strength coordination. There might be some motor skill exercises to improve the swallowing. Remember, we've talked before about how swallowing can be an issue for stroke users. Any things like swallowing will be normally taught on by the speech and language therapist. So sort of try and remember that. Mobility training, again, if people have lost strength in a leg and arm, they may lose balance, so they might need to get to learn how to use walkers, wheelie walkers, maybe even a wheelchair, but there's still issues to get used to with that. Or maybe using a special stroke stick that can help people walk. So you might be doing a little bit of work with someone on that, because it's about changing the way the balance goes, and people, there are techniques involved. Constraint-induced therapy is done quite a lot, and it can be very, very effective. So say if you've got your right arm has been affected, and maybe you're right-handed, you usually do your writing, you cut your food with that, so it's your dominant hand. What they tend to do is, instead of getting your left hand to take over all the time, which you will do for periods of time, if you can. But what they normally do is the functioning hand, as you can see in the pictures, they will pad up and put a weight on it so you can't use it to take over. So they will spend maybe half an hour working with you. If you have a look at A, B, and C, one's making a little sandwich there. One of them's pouring a drink of water. The other one's doing some fine motor work as well. And if you have a look at that, you can see that the good arm is being padded up, so you don't, because it's a natural thing to take over. So you might use if you can't pour your drink, you might use your other arm to steady. So they do that when they're actually doing very specific work with someone. So the good hand is out of action, so the work is all happening with the affected hand. Now they don't do that all day, because it's cruel, because people will be using their strong arm at other times, but they try to do a session every day like that. Constraint induced therapy can be really, really effective. It really depends how bad the affective limb is. There's another thing as well called range of motion therapy, and there are certain exercises that can ease muscle tension. So, like leg and arm muscle tension. If you're not careful, if an arm a joint isn't used, it can cause something called spasticity, where the muscles contract. So, like an arm that normally can stretch out will contract and sort of coming close. So they do regular exercises to keep those muscles nice and stretched so they don't have any contraction. So it doesn't, because once it gets very, very contracted, it's really hard to increase your mobility. Some of the technological activities or interventions we might do, there's something called functional electrical stimulation, which they apply to weakened muscles and it causes them to contract. And this stimulates the muscle and it tries to get it back working again. You can buy these things now. You can actually just buy them in pharmacies, little belts or they're a bit like some of us might know from years back, these slimming belts that you put on that send a little stimulating wave supposed to help get your tummy down. Those of you might, some of the ladies might remember this, but they actually work in exactly the same way. They're doing exactly the same thing, but they're not helping you to lose your fat, although that might be a side effect of it. I don't know, but it's really stimulating all those muscles. So they'll do it around where when we're trying to slim, they'll put it around the abdominals. This they will do around, legs that aren't functioning, or particularly around the muscles of the arm, and that stimulates them to keep moving. Robotic technology, there's a lot of work going on now using robotic devices which can be strapped onto impaired limbs to help people walk again. You may well have seen some of these developments. Wireless technology, lots of sort of monitors now as part of telehealth that we use to help people get active really. So even down to using your Fitbits, those of you who might have them, or your smartwatches, the way you can program things in so you do so many steps, all that sort of thing can actually work quite well for people who are recovering from stroke. You can sort of program certain movements in just to encourage them, just to remind them to do things. And nowadays, there's a lot of virtual reality stuff that's going on using video games to stimulate people. The guy there looks like he's having quite a good time using one of these VCR things, virtual reality things. But it can even be down to just using sort of games on your phone, games on your laptop, which stimulate the cognitive um, workings as well. Just simple games like match 3 games, and that it doesn't have to be Call of Duty. It can be these sort of match games or these brain training games, which do actually work and do actually stimulate some of the areas. Some of the cognitive and emotional activities, there might need to be some sort of therapy work, um, where a clinical psychologist might be involved and occupational therapy might be involved. Obviously, speech and language therapy, we already know about that. And we know how important that is to try to help people to get to speak again. Here's a little poster of some of the drills that speech and language therapists do. So you would try to sort of say out the sounds, and it gives you an idea of the mouth shape where you go pa pa pa, pa pa pa, and you can see the mouth movements as well. So they would get people to do that over and over again, 20 times over and over again, nice and clearly. So it's really good sort of muscle exercises, but also training you to sort of make those sounds again. Psychological evaluation, we've talked before that a psychologist might need to be monitoring people's moods. People lose motivation, people can get very, very depressed, very, very anxious. So there's a lot of work and intervention involved there from psychology. And there may be some medication involved. So your general GP might have to um, along with the hospital doctors, might look at antidepressants or medication for anxiety and things like that. There are some experimental therapies which I'd like you to maybe look into a little bit. Some things that are still being looked at, they're not being used regularly, but they certainly are being considered. Some other brain stimulation. We talked about the sort of muscle stimulation, electronic muscle stimulation. Now they're talking about using magnets to stimulate a variety of motor skills as well. Again, people who can't walk, they're using some sort of magnets to stimulate their brain to send the messages to the legs to actually move in a certain way. I'm going to ask you to look into that a little bit later. Biological therapies, you've probably heard a bit about stem cell therapy and how bringing in matter from stem cells can actually stimulate regrowth. And alternative medicines that have often been hovering around the outside. Some teams like them, some teams don't, but they are becoming a bit more accepted. They tend to be older than a lot of medicines, but they come in and out of favor. Things like massage, acupuncture, oxygen therapy, and herbal therapies can all have a place in people's rehab. So you can take some time out here. You can either stop and do a little bit of research now, or you can do it after you've had a look through all the slides. I'd like you to research some of those experimental therapies, transcranial magnetic stimulation, as I mentioned, stem cell therapy, and how acupuncture is used in strokes. Find out a little bit about it, how they've been used to help people with stroke, and see if you can find what the results are. So that's a little thing. You can just write some notes that you might want to use it in one of your assignment answers. It's just about sort of developing your depth of knowledge here, really. Okay, how long does stroke rehab last? How long is a piece of string, really? It depends very much on the individual. Stroke rehab should start within the first 24 to 48 hours after their stroke. It should really start in hospital, and certainly some plans should be made during that time. It depends where people go after that. If they go to a specialist rehab stroke unit, they might stay there a bit longer and really get their rehab going. The duration really depends on how severe someone's stroke is, what bits are affected, the age of the person, how motivated they are. So all sorts of things. Some stroke survivors, especially those younger who are quite highly motivated, can recover quickly, but most of them will need some form of long-term rehab. And rehab can last months or even years after someone's stroke before they gain maybe all of the strength back in their leg or their hand or their brain or their speech. So the rehabilitation plan will be reviewed very, very frequently, and every change will be acknowledged, and the next sort of skill to relearn will be added to the plan. So they don't have a huge plan with all the skills that you need to relearn, because that would be extremely daunting and quite hard. So they break it down into a few skills on one plan, and then once some of those are achieved, they'll sort of add other ones. So you're only working on a few things at a time, because otherwise it's just too overwhelming. Where does it take place? Lots of different places, really. If someone's moved to a stroke unit, so an inpatient specialist stroke unit or specialist rehab unit, they can be part of a hospital, or they can be outside in a maybe a community clinic. They may have an inpatient rehab unit that might be out in the community, and they may stay there for about 2 or 3 weeks and have some seriously intensive rehab program. Usually tend to stay, I think in the UK it can be up to 6 weeks for rehab, but that will differ depending on the different health authorities. You could go for an outpatients clinic, so from hospital you could go home and then come to outpatients appointment if they can't get around. They may well be picked up by ambulance or by car to be taken to appointments. And they can spend a few hours in the facility, maybe a couple of days. They often come in for large portions of the day, so that the particular sort of OTs, physios, speech therapists can actually spend the time with them, so it'll all be booked in, rather than them coming or going, so across the week. Skilled nursing facilities. You can get specialist stroke care nurses that might work in the community with you at home, or they'll be attached to a specialist rehab unit. Some specialize in rehab, and others might do the other sorts of support. So that's sometimes, unfortunately, that can be a bit of the luck of the draw what you get. Home-based programs, you can have therapy at home, gives you a bit more flexibility. You can also, this is a way you can involve family and carers as well. One of the drawbacks about doing it at home is that you don't have all the specialist equipment. Because as you can imagine, some of it can be quite large and bulky. You might be able to buy some bits, but you probably won't, have a full-scale gym, which they often do use in the rehab unit. And additionally, there are some issues about insurance, about what can be taught on to unskilled professionals, really. So certain things can, some of the exercises can, and some of them, like the speech therapist swallowing assessment, they wouldn't be allowed to teach that on. So you'd have to bring someone in to do that. So it can make your process a bit slower, and it could mean that you don't get access to all the skilled people that you might want. So I know whilst a lot of people do want to go home, they might want to think on those sorts of things. So who is the stroke team? One of the questions is asking you, what are the roles of the stroke team? So here's a picture of the average stroke rehab team. Just take a moment before you turn onto the next slide to jot down some of the people you think might be part of the stroke team, and then we'll have a look and see if you've covered them or if you've missed anybody. So just take a moment to do that before you change the slide. Okay, so let's see who is part of the stroke team and what do they do. So first of all, as a physician, a doctor, okay, it would be your GP would be involved, having a connection with the stroke team, but also if you're in a specialist rehab unit, there will be a doctor with specialist skills as well, generally around stroke or certainly around rehabilitation, and they would do extra training to do that. So they would be involved. They might have sessions from a neurologist as well. If you're looking at some of your cognitive issues, they may be brought into it. They might just come along for the odd afternoon session. And these guys can really help be part of the care plan. So they're bringing in their specialist skill. They can guide some of the care, and they're around to make sure that there aren't any complications. So if something's starting to go wrong, they can be called and say, well, okay, what can we do? What's going wrong here? Rehabilitation nurses, they too have specialist skills on top of their normal nursing skills, and they sort of are the next step down for the doctors. They make sure everything's incorporated in the daily routine, but they're very good at observing and reporting on where things aren't going well and where they are going well. They know what to look for in a way. So they will do, after their initial nurse training, they will do some specialist rehabilitation training if that's something that they're interested in. And then they'll be looking for jobs in these specialist rehab units. Some of them may be completely working with stroke. Some of them will be working in the general rehabilitation for, because apart from stroke, rehab units can have people following accidents as well, where they've lost movement too. So they could often be in a similar unit. Physical therapists or physiotherapists, we know that they're really to work on the muscles, the body, the balance, the standing, and they help people relearn their movements. and to be able to walk again and keeping their balance, those sorts of things, and gain the strength to do the work. And they usually do it by very well assessed sets of exercises that focus very much on the different muscle groups that have been affected. Occupational therapists, they do a little bit. They carry through some of the physical therapists' work, and but they will do sort of more fine motor stuff. But they'll be focusing on daily living skills. So whereas the physical therapist will be sort of looking at the muscles in more in an exercise way, say like showing, getting you to do those sort of movements, the occupational therapist will be helping you to pick up a cup, helping you to hold your knife and fork. So they will be going through relearning some of those skills, doing managing your own self care, learning how to wash and dress yourself again, putting on your shirts and tops, those sorts of things. They can also carry through some of the plan from the speech and language therapist. If there is a swallowing issue, the occupational therapist, they will they won't really set the plan out, but they will just pick up, and they know to monitor that sort of thing. So if there is a concern, they may well have to call a speech and language therapist in, but they can monitor and keep working with people. They're particularly concerned about, helping people to do things in the safest way possible. So if there are areas where people aren't going to relearn that skill, then they'll be looking at safety, shortcuts where people can use aids. So they're the guys who might bring in walkers, help you get a shower adapted for long-term use. There are other specialists who focus more on the cognitive and emotional side. Speech and language therapists, we know, as well as swallowing, it's about helping people to address their language and to remember words. So they've got lots of very specific skills. So they work with the muscle memory on actually speaking again, but some of the issues are about remembering that word. I look at a picture, I hold up my mug, and I cannot remember the word for mug. So they would do exercises with you and quizzes, all sorts of things, so that to help you remember those words and pulling those words out of your brain. Psychologists will be looking at cognitive issues. They will be frequently assessing to see what damage is there, and then frequently assessing to see where things have improved. They're also available for those sort of emotional issues as well. So people feeling depressed, anxious, the psychologist will be able to step in there, and they may be able to do counselling, or they may need to prescribe medication, various things. Therapeutic recreation specialist, that's a big mouthful, but it's about people who help people get into activities like hobbies and um, activities in the community. So you can be art therapist, it can be a gardening therapist, it could be a music therapist, and they might come in and they will do special sessions with you. And that's about joining the community again, feeling achievement, feeling the sense of worthwhile, that you've done something worthwhile. Some people really enjoy expressing themselves through art therapy, particularly when their language has been affected and they struggle to communicate. They've actually found spending time doing art therapy a way of communicating, and the same with music therapy as well. People have found that very good. Dance therapy, for those people who have got some movement, can be ways of using their body in a different way too. Again, they would join groups or work one-to-one depending on what your plan is. Social workers are there to do the sort of basics, to help to deal with the changes. Uh, if new living arrangements are required, the social worker needs to see that through. If people are moving into care homes, if people are having their home adapted, the social worker would be involved. They're aware of what all the resources are in the community. They'll put you in touch with the right sort of people, and they help manage finances. When people have a level of disability, there are certain grants and funds that they can apply for to help support them, and the social workers would be there for guidance and help make the applications. Vocational counsellors for those who particularly want to go back to work, often very much the sort of younger stroke victims. And vocational counsellors are very helpful with people who maybe realise that because of the effect of the stroke, they might not be able to go back to the work that they used to have. And vocational counsellor can help them look at their transferable skills, maybe find jobs that they are more suited to now if they want to. So, what factors affect the outcome of stroke rehabilitation? Have a little think about that. It varies from person to person, as I said, and it's really hard to predict, so there isn't really a proper answer. But things like the severity, looking at the physical factors, how severe has the stroke been? How much paralysis is there? What is the walking situation like? How much has it affected people's cognitive ability to think and answer questions and go forward? What's the emotional factors like? What is their mood like? As I said, motivation is huge. If people are motivated, they can achieve things which maybe some people might say, well, you know, they're too badly disabled, they won't be able to do that. But people have been motivated to walk when other people have said they can't. So, you know, never put down someone who's got lots of motivation. And that emotional situation, if someone's depressed and anxious, it's very hard for them to stick with their rehabilitation activities. So fine, maybe when they're in a session, but it's that bit of keeping it going when you're not in a one-to-one session, but trying to do it every day around the house a little bit. Social factors, the support of friends and family can be massive. They can be really encouraging or discouraging depending on the approach that they take. So that can have that could be a real factor that affects people. When the therapeutic factors come in, the earlier the rehab starts, research is very clear on that, the better the outcomes. How skilled the rehabilitation team are. Obviously, if you've got a highly skilled rehab team, then the chances of you developing are much higher. Rate of recovery is generally greatest in the first weeks and months after a stroke, but all is not lost. If you know, some people have been able to improve a year to 2 years later. So some people can be a bit slower than others. As long as there's some element of improvement still happening, people, you know, the rehab process can keep going. Okay, there's a set of references just for you to have a look at. You might find them useful. And that's it for this session. Okay, thank you. And I'll see you again for the second session for our 4th week of stroke. Okay, thanks. Goodbye. I'll see you later.